Hi, my name is Samagya Banskota. I'm an assistant professor in biomedical engineering at Boston University, and I received the PhRMA Foundation Faculty Starter Grant in Translational Medicine. So from a very young age, I was drawn to math and science. Just maybe my teachers in schools were quite inspiring and encouraging. So I wanted to have a career that had both science and math as discipline. And I grew up in Nepal, so the only career that I saw that was related to this was either being a doctor or an engineer. And I never met scientist or researcher before I came to the United States and I pursued my undergraduate education here. The first thing I realized is there's a major called biomedical engineering that basically combines medicine and engineering because we're engineering for human health. The other thing I got to explore was undergraduate research, where my first research experience was looking at patient samples from patients who had cancer, where we were trying to profile early markers or biomarkers that could be used as early diagnosis tools or as alternative therapeutic strategies. And this really made me realize how advanced biomedical engineering can be impactful for human health. And then everything kind of clicked together, and I really wanted to do research because it allowed me to discover new things while also making an impact in patient or human health. A single misspelling error in our DNA can cause genetic diseases. So my lab works on technologies that allows you to precisely correct these misspelling errors in our DNA that cause genetic diseases. So the PhRMA Foundation funding supports our work in applying these technologies for a rare disease called Wolfram syndrome. Clinicians have seen patients with Wolfram syndromes sometimes have severe symptoms, sometimes not so severe. So what we're trying to do is by using gene editing technologies, create cell models that allows us to really understand why some patients have severe symptoms and why others don't. And at the same time, develop therapeutic strategies using precision genome editing technologies that allows us to correct the mutation that causes Wolfram syndrome. As a junior faculty who's just starting and building her lab, a lot of times we don't have preliminary data to go after conventional and traditional grants. So getting this award has allowed me to build my team to get these preliminary data, which will then allow me to go after these bigger grants. So now that I'm a biomedical engineer and a scientist and an assistant professor, I honestly think I have the coolest job, but I could be really biased. The reason I think it's a really fun and cool job is that I get to work on advancing human health. I get to brainstorm and test new ideas in lab, collaborate with clinicians and other experts, and engage with people from diverse perspectives across different disciplines. And I think one of the most exciting parts of doing all of this is, at the end of the day, run experiments in lab, test hypotheses, right? And a lot of times you're uncovering new knowledge that nobody knows at the time. And that is, quite fun for me. Doing all of this, you also get the opportunity to train the next generation of scientists. And I really enjoy teaching and mentoring students. This career for me brings all of my passions together. So I think it's the coolest job. Yeah, I think one of the best advice that I've gotten, and it must be something that maybe a lot of people have already heard of, is like comfort and growth cannot coexist. So if you're really looking for meaningful growth or professional development or even personal growth, right, you oftentimes have to step into unfamiliar and challenging spaces at times. Like, it's going to be uncomfortable, but then as you go deeper, it becomes that becomes your normal, right? And then you learn to adapt to it. So as an early career researcher, I think it's important to seek out opportunities that stretch you, whether it's across disciplines, whether it's learning new skills or taking up new leadership roles or pursuing bold scientific questions. I hope the technologies that my lab will build will one day be used for the benefit of patients with rare genetic diseases. And then second is, as a junior faculty, hopefully I would have a lab where, I would have a lot of trainees that have graduated and have become next leaders in biotech and the pharma world.